Hi, Ms. Smith. My name's Kate, and I'm one of the nurses from the cancer clinic. I'm calling you today to follow up about a recent switch in medication. Is now a good time to chat about that?
Yes, it's a good time for me now.
Yeah, so during COVID, it's definitely safer for us to conduct these conversations virtually if possible. However, I do want to let you know that if there is something that comes up today that we feel that an in-person appointment would be best, then we can definitely arrange that. Does that sound okay to you?
Yeah, good to know that I can come in if I have to, but much more convenient to do it this way first.
Yeah. So is there someone with you today on the call, or before we begin, is there someone that you'd like to go grab to sit in on the appointment with you?
No, I'm by myself, but I'm okay with that. I'm good.
Okay. So 2 weeks ago, we started you on some morphine for your mid to lower back pain. You were prescribed 10 milligrams to take every 4 hours by mouth. Is that correct?
Yes, that was how I was told to take the medication. Yes.
Good. And so I'm interested to follow up with you as to how you're doing with that medication and just make sure that we're on the right track and communicate with your doctor if there's anything that we need to adjust or chat about. Do you remember when we spoke 2 weeks ago before starting the morphine, we went through a series of questions to talk about your symptoms?
I do remember that. And I sent in another one this morning so that we could compare.
Yeah, I actually have both copies here, so thank you so much for taking the time to do that. That assessment's called the Edmonton Symptom Assessment System. Basically, it just gives us a snapshot of how you're doing in the current moment, and it allows us to see how you're doing now that you're on the medication as well. So to start, I see that before you started your morphine, you rated your pain a 6. And for today, you rated your pain a 1. So I'm glad to see that. It looks like your pain is being managed better. Is that correct?
It is. I feel a whole lot better. During the day, I'm pretty good, and I feel pretty comfortable. But sometimes in the morning, when I wake up, I'm really, really uncomfortable. It takes me a few hours to get comfortable. I'm wondering if it's because I'm not waking up or I'm too tired to take the doses at nighttime, like in the middle of the night, when I'm sleeping.
And when you wake up, are you finding that it's the same pain that you're having, that mid to lower back pain?
Exactly. Yeah.
Okay. So it does make sense if you are missing a dose in the middle of the night as to why you probably are waking up with pain, and that the preparation of the morphine that you're on only lasts for 4 hours before you have to take your next dose. So if you do miss a dose, then it's understandable why you're experiencing that pain in the morning. What I'll do is I'm going to make a note of this in your chart, and at your next appointment with your doctor, perhaps your doctor could chat to you about a longer acting preparation where essentially you're still getting the same amount of morphine every single day total, because it does look like when you do take your morphine that your pain is managed sufficiently. But with this preparation, you'd only have to take it every 12 hours, so you wouldn't have to wake up in the middle of the night to take your dose. Does that sound like a good plan?
Oh, that would be much, much more convenient for me, I think.
Yeah. So next, your tiredness. So before you started your morphine, you said that your tiredness was a 4, and now it's a 1, which looks like you're experiencing more energy. Is that correct?
Yeah, I think I am. I think it's because my pain is feeling better. When I first started my medication, though, I noticed for about 2 days or so, I was really, really tired. But
Hmm.
that seems to have gone away, and I'm feeling much better.
Yeah, it's quite normal for patients to initially experience some tiredness when they're starting morphine, just because their body is adjusting to the new medication. But as you've probably noticed that as you've taken the medication for a little bit more time, that tiredness subsides. So is that correct? You're not feeling as tired as,
No, no,
okay.
I'm pretty
Yeah,
good.
that's good. Um, so looking at some other factors, your nausea and appetite. Before the morphine, you said you were a 1, and then now you still say you're a 1. So those look like they're being managed pretty well.
I think so. I don't, that's not interfering with my day much.
Good. And then same for shortness of breath, depression, and anxiety. You rated yourself a 0 before the morphine, and now you're still a 0. So nothing
No.
changed. Good. In your well-being, that's really important for us to look at because it lets us look and see how your quality of life is doing and if you're able to do everything that you're wanting to do in your life. So before starting the morphine, you said you were a 6, so that's ranging more into the area of you're not really experiencing good well-being. But today I see that you've rated your well-being a 1, which tells me that your well-being has improved. Is that right?
I think overall, because of the medication, I'm just feeling so much better.
Yeah, and can you tell me a little bit about the things that you're able to do now that you're on the medication?
Yeah, so a couple weeks ago, I found it really difficult to go out for walks and do those types of things, which now I can do, and that makes me feel generally happier. I also noticed that my back would hurt a lot when I was standing at the counter trying to cook, and I really kind of dreaded doing that. And now I can stand and cook my own meals, and it makes me feel much better.
Oh, I'm so happy to hear that. Yeah, definitely during these COVID times, it's wonderful now that you're able to get outside for some fresh air and go on walks. I know I've enjoyed walking my dog and cooking a bit more at the kitchen. So I'm really happy to hear that those
Yeah.
things have improved for you. So the final thing I want to chat to you about, Miss Smith, is constipation. I don't know if you remember, but at your last appointment before starting the morphine, your doctor likely talked to you about how constipation is a common side effect when you're on morphine. And from your chart, it says that he started you on some Restoralax. Have you been able to take that these past 2 weeks?
Yes, I've taken that every morning. I put a capful of the powder into my coffee.
Good.
So I have been doing that, but
Yeah.
doesn't seem to be doing the trick.
Yeah, I see here that you said that you're a 5. Which tells me that it's not being managed as well. Can you tell me a little bit about that? How often you're having a bowel
Yeah, my
movement?
bowels are really only going every 4 days, and by the time I go, it's really just not comfortable,
Mhm.
and you know, it's hard. The stool's hard. It's just not comfortable.
Yeah. And how much water are you drinking a day, just so I can have an idea?
I'm drinking about 6 glasses a day. I know I should try to bump that up a bit.
Yeah, but still, that's still a good amount of fluid, and you are on the Restoralax. So I'm definitely going to make a note of that in your chart because I definitely think that there are other options that we can look at to make you more comfortable and to help with this. So I'm going to mark that in your chart so that at your next appointment, your doctor can talk to you about some other options. And I'm also going to mention to her about your morphine in that sometimes you're not able to wake up in the middle of the night to take it, so you're waking up in some pain, and perhaps she could talk to you about a longer acting preparation so that you don't have to take it in the middle of the night. Does this sound like a good plan to you?
Yes, I hope that that's something that's possible because that would be much more convenient for me.
Mm-hmm. And is there anything else that you'd like to talk about with me, or do you have any questions for me at all?
No, I think you've covered pretty much the main issues for me, and I really thank you for giving me a call today to help me with this.
Yeah, and as always, if anything comes up or if you have any questions, feel free to call the clinic and we're happy to chat with you or to set up another appointment. So, um,
Thank you.
yeah, thank you. Bye.
Bye.